All right, so now we're moving on to masseters, and we're actually going to inject Amanda and her masseters because she does clench and she might grind at night, and she does have some jaw pain. This is more of a therapeutic thing. It can be an aesthetic thing too, but therapeutic wise, your masseter is a pretty large bellied muscle over here. And the more tension we place on and the more we use it, the bulkier it can get. So if you do have a thin face or a wide set square jaw, masseter is contributing to that shape. So when we do inject it, it can give you a little bit more of an angular shape. Again, of course, with everything, some people aren't eligible or they should not be injected. If you are older or predisposed to a little bit of jowling over here, then this masseter is actually pulling back and holding some of your skin. If you do relax this muscle and flatten out the masseter, some of that skin may go forward and cause a little bit of redundancy or fullness over here, adding to that little baby jowling. So some people decide to do it despite that, just because the relief that they get over here. How we find the masseter is we're going to look for the medial border. Go, and you could feel it. Go ahead and clench for me. You see how she popped up like that, and relax. And the superior border, clench. Yeah. And then relax. And then the posterior border, go ahead and clench. Good. So her masseter is a little bit larger than this, but I like to draw a smaller border just because this is going to be the safe zone. If you go a little too superiorly, a little bit too laterally, or even if you go too posteriorly, you could be hitting structures that you're not intended on hitting. So what I like to do, and again, it's patient dependent, but her masseter and the shape, I'm going to do a little triangle just like that. I already cleaned her off, so I'm just going to do 4 units in each injection spot. And what I find is actually when the patient clenches and I inject them, that doesn't pinch as much. So go ahead and clench. 1, 2, 3. So your masseter is a muscle, and it's separated by fascia. And that fascia will separate the deep to the superficial. If you inject too superficially, you'll get a walnut at the end of 2 weeks. Go ahead and relax. If you have a walnut, you just need to inject a little bit deeper. You just didn't get that deep muscle. So this is a deep injection, as you saw, that I went with my needle all the way in. How'd that feel?
Good.
Any issues?
No.
Did it hurt?
A little bit.
Okay, well, that's the pinches. With the masseters too, when I go to the other side, I already have the dosage drawn up, but I like to use a separate syringe because it's a separate needle. So remember, every time you stick somebody, the needle is going to dull, and that's going to cause more and more discomfort. And this is especially important for when you're doing full face toxin or even filler.